in most consultations, I think if you get the beginning right, the rest of it tends to go fine. Because we're doing it in the absence of quite a lot of familiar cues when we're consulting remotely, the dynamics are subtly different. Most of us have a kind of routine for opening the consultation. It's come in, sit down, what can I do for you, or something like that. But I think when the patient is particularly if it's a telephone consultation, which is what most of the remote ones are now, the patient starts slightly flustered because they're not necessarily familiar with consulting in this way, and they're slightly uneasy. So it sometimes, I think, takes a little while for a patient to settle down and feel comfortable. And I don't know what it's like for most of you people when you get a phone call. Perhaps it's a scam call or one of these automated messages. What you hate is the person saying at the other end, "Hello, how are you today?" in a way that you know they're just reading from a script, or closing the conversation with, "Now you have a nice day now," when you know they don't really mind what sort of a day you're having. An awful lot of making a success of a remote consultation, I think, is to do with making it personal, and how you can try to make things personal over what is a communication where a lot of the things that we normally rely on, the sight, the proximity, the ability to reach across and touch, when those things aren't there, I think it does make it particularly hard. I think one of the most important things we have to try to find is a way of getting that sense of connection early on in the consultation. If I could coin a phrase, let's talk about digital warmth, trying to communicate warmth and empathy over a remote and artificial barrier, and it's different. The single most important thing I think that you can do to put somebody at ease and get them talking to you in a free and open way is to pay them really good attention, and also for them to know that you're paying really good attention. Now, if it's face to face, it's not that hard to show whether someone's paying you good attention or not. You can tell where they're looking, you can tell whether they're doing something else, you can tell whether they get their nods in the right place and whether they go at the right time. And quite a lot of that information is missing. The most important part, I think, of making a success of a remote consultation is what happens before you actually make the call. Because if you think about the things that need to go on before you lift the receiver or set up the connection, the patient has got in touch and perhaps been shepherded or through an unfamiliar triage system. They might have had to do that online, or they might have been assessed initially by a receptionist, perhaps following an algorithm, and that makes things quite tricky. Also, in terms of making a success and getting those first few moments right, the doctor's own mindset, I think, is really important. We're always told that we can multitask, or we kid ourselves that we can multitask, and we can listen to what the patient's saying, and we can look at the notes, and we can check on the path results, and we can feel the note from those parts. We really can't. And so I think it's anything that we can do to before we lift the receiver or begin the consultation, to improve our own concentration by having a nice clear mind. I think that's really important. I personally think that with a remote consultation, it's more important than ever to have some kind of structure in one's mind about how the consultation is to go. For the consultation to follow some kind of structure that's going to serve you well and be comprehensible to the patient is important. I personally like to think in terms of three successive parts to the consultation. I think it needs to begin with what we could call the patient's part of the consultation. That's where we allow the patient, encourage the patient to tell us what's on their mind, what they want, what their symptoms are, what their problem is, in their own words, without us interrupting. So patient free time right at the beginning. And then I think it's worth thinking about then consciously moving on to the second part of the consultation, which we could call the doctor's part of the consultation, which is where you, the clinician, do the medicine, where you ask the ask the medical history, the details, and the red flag questions, and all the other medical stuff that we need in order to make an assessment. So patient's part, then doctor's part, and then finally, third and final part of the consultation, which we could call the shared part of the consultation, which is where the two of you work your way together towards an outcome. But if you've got that sort of sense of structure in your mind, and particularly if you can tell that to the patient so they know what's happening, that of itself gives a kind of sense of security to the patient, which I think makes it easier to keep that good consulting going. If you think about the way we consult face-to-face, particularly if you're an experienced doctor, we use silence a lot. If we're talking face-to-face with a patient and we can see that there's something on their mind or they're worried about something, we will probably just shut up and let a little time go by and let them formulate their thoughts, maybe prod them a little and say, what's going on, what are you thinking about? Seems like there's something else on your mind. That's difficult to do over the phone. So in a way, we have to find some other more subtle way of communicating to the patient as the consultation is unfolding. We have to have some more subtle way of signaling to them that, yes, I'm hearing you, I'm understanding, I know what's going on, I have understood what you've told me. And I and one or two other doctors of my acquaintance like to use the word receipt for that. The idea that every now and then when a patient tells you something important, give them a receipt for it. I don't mean a written receipt, but a verbal thing. Say something out loud to the patient that shows them that you've understood what they've said. It's important to say something like, oh, so you've had a lot of pain that's been bothering you. I'd like you to tell me more about that. Or you were describing, Ash, tell me exactly what it was like. So giving those receipts are more important than ever. One thing which experienced doctors perhaps need to do rather more of is to create opportunities for the patient to go a little deeper and perhaps to say out loud a bit more often things like, tell me more about that. I'd like to know what you thought about that. Or how did that affect you? Remarks like that give the patient permission to express things that face-to-face we might not have needed to encourage out loud. And I think perhaps just the final point I'd make in this whole area about digital warmth, trying to communicate that sense of rapport and empathy, is I think it's important that we to try to keep an open mind about what's going on as long as possible. We're taught, aren't we, about this idea of the golden minute, the idea of not interrupting the patient, because left to ourselves, we tend to interrupt patients very quickly because we're experienced clinicians, we tend to think we know what's going on, and sometimes to jump to the wrong conclusion, we sometimes misread it. I call that premature medicalization. It's thinking we know medically what's going on actually before we've got the full information, and it's very easy then to jump to wrong conclusions and to miss the point. So as part of this whole business about the mindset that we have during a consultation, in particular a remote consultation, this idea of trying to resist the temptation to think you've got it, to resist the temptation to think you understand what the problem is before you've really got all the information, which is where that idea of the patient's part, giving the patient the floor, encouraging them to tell you in their own words as much as possible right at the beginning of the consultation. I think that's where that comes into its own.